Hi, everyone. It's 11 o'clock, so we're going to go ahead and get things started. Thanks so much for joining us today. I'm Kebra Shellhammer, VP at Route 3 Marketing. The webinar today will be roughly 30 minutes, so feel free to submit your questions directly to our organizers using the chat feature. We'll try to cover as many as we can throughout the webinar. We hope to kind of weave them in to create more of a conversation. We're going to send the PowerPoint and the recording via email later on this afternoon. So let's get started. I want to introduce you to Andy and Scott, our presenters today. Andy Busch, Andy, if you want to go to the next slide. Andy is an outside economic advisor to the White House. He's a former CNBC host and speaker and economist. He just published a 3-month framework of how the economy will respond if the shutdown ends on May 1st. So he's going to share his insights, and he's joined today by Scott Christiansen, CEO and founder of Route 3. So Scott built Route 3 as a B2B marketing firm, and we are dedicated to delivering growth strategies that remove barriers to sale, shorten the sales cycle, and lower the cost per deal. So Scott was a former executive producer and covered global markets before he decided to settle in Chicago, put down some roots, and open our agency. So I think we're all excited to get things going. I'm going to turn things over to Scott, and we'll look for your questions throughout the webinar. Thanks so much.
Thanks, Kebra, and Andy, thanks for joining us. What Kebra didn't say is that the only reason Andy was successful on CNBC and Reuters and the banks was because of a great producer, and it's really all about me. So Andy, the reason that I wanted to bring Andy to the Route 3 community to talk about this is Andy and I have worked together for years for governments, for banks, big business, for Reuters, for CNBC, all of these places. What Andy's really good at is taking global events, taking political events, taking the markets and putting them together into real business decisions, not just economic theory, but real actionable business decisions. And so that's why I wanted Andy to come here today to talk specifically about healthcare and marketing and what ramp up could look like. Now, Andy, you just wrote an article talking about May 1st as a reopening. And something happened today that I want to start with, which is real strong action from the Fed. Let's talk about that and give an overview on that, and then also how that may add a little bit more proof to your thoughts that May 1st is the date.
Okay, yeah, for sure. And that's the slide that has the economy reopens May 1st. You can get that at andrewbusch.com if you want. And I thank you, Scott, for that wonderful introduction. Totally dismiss what you said about your capabilities. And I would say, ladies and gentlemen, I continue to work with Scott. That really underscores Scott's skill sets. They're tremendous. So with that in mind, let me just, this virus and the outbreak and the reactions to it, it's the craziest thing I've ever seen. But I will tell you, it's not crazy in the sense of crises. Let me just tell you a really quick story before I talk about the Fed, and then we'll run through a lot of the stuff that's going on with the economy. You know, last night I had a birthday party for my mom. Now, she's 90 years old, and we originally wanted to have a massive party, and you can understand it's like having a wedding or so on. I have 6 brothers and sisters. They have children. There's grandchildren. I mean, it would have been huge, but of course we had to cancel it. And what did we end up doing was just, I had my mom over at my house. I had my wife, one of my kids, and we set up a WebEx so that all my brothers and sisters could be on. So, I mean, you can see how people adjust, right? But what's really interesting, what she said afterwards, talking about crises, she said, you know, Andy, when you get into your 50s, if you haven't been through at least 3 personal crises, you really haven't been paying attention. And I think that's really instructful for everybody out there to realize that crises come up all the time. I can just rattle off, since I've been in the markets, there's probably been about 8 that I've gone through. 1983 Volcker high interest rate recession, the 1987 stock market crash, the 1995 peso crisis, the 1997 Russian default, the 2001 dot-com bubble burst, the 2008 financial crisis, the 2012 European debt crisis, and of course today's crisis with the coronavirus. So just keep that in mind. There's tremendous opportunities that come from these crises if you can keep your head and kind of look forward to what's going to happen next. And that's what we're going to get to. So today I want to start off with the Fed programs. These just came out this morning. They're massive. This is a lending program that the Federal Reserve has created on top of what came out of the $2 trillion plus spending program from the US government that was approved by Congress and signed by the president. This is another program on top of that to backstop a lot of the lending programs that are out there that are moving forward. You may have heard of the PPP program. You may have heard of some of the small business lending programs that have been created under that stimulus plan, $350 billion worth of lending that's there. Well, what the Fed did today is say to the banks that are making those loans, hey, we're going to backstop you, so go ahead and put that money out there. And that's really important, because I know there's probably been some hesitancy on these banks to really move forward and make loans as quickly as the Treasury wants them to, without having that backstop behind them that says it's okay to do that. They also in the program, and I don't need to get into too far of the details of it, but there is something that's really interesting. It's going to help state and local governments manage some of their cash flow stresses caused by the coronavirus pandemic by establishing this unique lending facility, a municipal lending facility that's going to offer $500 billion in lending to states and municipalities. So that's another really great example of the federal government. I know this is hard to believe, really stepping up and doing as much as they can, throwing everything they can at this government mandated economic shutdown. So that's just the latest right there.
So Andy, it seems like the plan from the US government is to go big right now, so they don't have to keep doing it and trickling in and support a big push. Is this action by the Fed today more evidence of what you're saying, is that you think the White House is going to move to at least partially reopen the economy on May 1st?
Yeah,
that's some of that data that you're looking at too.
Yeah, so I'll tell you what, I'll run through the data in just a second, but yes, that's really, we have made a decision as a country to really put first and foremost the lives of our citizens and the reaction that the government had to the pandemic, right? So we've made that decision. What we have to do now is balance that, because we know those numbers are coming down. We know that the shutdown and the social distancing is working. We know this. Now we have to balance out the incredible harm that we've caused by the economic shutdown. I'm going to run you through some numbers that just came out today that really emphasize that, the just incredible damage that's been done to the U.S. economy. I'm sure many of the people on the line have been feeling it. I really sympathize for anybody who had to lay off people. I know that's been going on. I have a lot of friends that's happened to. And I want to say that's why I strongly believe that as we look forward, they have to get the economy up and running as soon as they possibly can. So let me just go through really quickly what the markets look at and what the White House is looking at for sure with their economic advisors. So to that end, this is this slide here is probably what everybody's seen recently. This is the Johns Hopkins coronavirus data. This was from yesterday. It's already over 1.5 million people worldwide. The reason why a lot of people look at this and what we're keenly interested in, and this goes back to a lot of research that I did, in writing of the book that I wrote, World Event Trading, where I dedicated 5 chapters to infectious diseases. This is why I'm familiar with this topic.
That's 2 promotions, just in case anybody's keeping track, yeah. But go ahead.
I'm doing my best to keep them down, but that's the book, that book right there. Yeah, okay, so what you do is you take the number of deaths, right? You're really focused on the mortality rate. And I'll tell you why in 2 seconds, right? So take that number, let's say it's 87,000, and you divide by the number of people infected, that's 1.475, and you get a global rate of almost 5.9%. Now, to put some context on that, the seasonal flu, which everybody understands, that infects about 30 million people per year, and that has a mortality rate of 0.1%. So in other words, about 30 million or about 30,000 people. So you can imagine what the numbers are if this is the true mortality rate. So that's why people are pretty, to put a technical term on it, freaked out by this virus, because it's very infectious and it has a very high mortality rate. That's why we've taken the actions we have as a nation. Now, what do the markets look at? So they look at this, they're concerned about that, but they're also looking at something else. Now, in the United States here, just as an example, our mortality rate's around 2.7% to 3%. It keeps fluctuating. So ours is lower than the rest of the world. Places like Italy and Spain have rates of almost 10%. But just keep this in mind. We really don't know how many people are infected. That's the problem. That's the problem that we ran in with the testing and the testing kits, but really it's a global phenomenon. We don't know how many people are infected. So we really don't know what the mortality rate is. So keep that in mind. But as far as the markets go, this is what they look at. So this is the curve that they're talking about in the United States. And these are the daily infection rates, and you can see that they're going up significantly, but that's not what the market's interested in. The market's interested in the logarithmic rate, because that gives you the rate of the change of the rate of change. And this is the smoothing of the curve that you're starting to see. That's one of the reasons why you've seen such a significant rally in the markets recently, on top of what New York, the Governor Cuomo said, is that they potentially could be seeing a peak right now for infections. And that's really what we're looking at. We're not looking for the peak for mortality, because to say, to be a little bit coarse about that, that's somewhat baked in the cake by the number of infections that you have. But if you start to see a decline in infections, then you know that the number of people dying will go down, right? They're linked, obviously. So that's what we're really keeping a close eye on when it comes to this. So this is one of the major indicators. Now, let me just run you through really quickly the devastation that's being impacted and put on our economy. Today, we got the initial jobless claims, and I know this is a little bit hard to see, and it looks like it's just bumping along there, and what I've got is probably over the last 30 years. You can see the gray areas for recessions. To the far right, that is not just part of the gray that's surrounding that graph. That is actually the peak of what we're seeing at 7 million people applying for jobless claims. You can see that it's significant. It's so much higher than what the peak was during the 2008 financial crisis. Just to put some context on that, it's extraordinary. This is going to lead to where we're estimating that jobless in the United States, or how many people are going to be unemployed, in April is going to be something close to 15 million people. That's just a number that's really hard to get your head around. And that's why there's so much pressure to get the economy back up and working. Let me just toss a couple other things out at you. This should be continuing claims, which looks very similar. It's just an extraordinary number, and that just means that the economy continues to be under duress from what's going on. Continuing claims are things that people are just asking over time, and they get added to it from the initial jobless claims. Let me get to the next one. Let me just see. I'm not being able to forward this on much. Let's see if it catches up. Okay, that's continuing claims, and you can see that they did peak, obviously high, about the same level where we're at right now, back in 2008. Here's another statistic that I think is really interesting, and this just started coming out. This is a weekly GDP number from the New York Fed, and you can see it's representing very clearly what we're expecting for the economy so far in the second quarter, and it's a decline of 6.5%. I mean, that's incredible. I've never seen anything like that. It's clearly below the levels, if you can see on to your left, of where we were back in the financial crisis. So we're already below those levels. So again, really a massive collapse of the U.S. economy.
Okay, thanks for depressing everyone, Andy.
Right.
Appreciate that. Look, you keep the one bright spot that you're talking about through this is, and you're using it as a market as an indicator. The market's telling us something about confidence on ramping back up.
Right.
Tell us what you're hearing from the White House, from the markets, putting all that together. What is ramp up going to look like? How fast can we impact those job numbers in a more positive way?
Sure. Yeah. So the way that I think this is going to work, and you can get some of this in the article that I wrote. Again, there's a little self-promotion, but the way that I look at this is that it's going to be a phased rollout of what a reopening is going to look like. In other words, the states that are already not closed down, and there's probably about 8 of them, they're going to not really experience much of this. These are states from an economic standpoint are much smaller as their contribution to overall GDP for the United States. They're already open for business, places like Iowa. But for the rest of those that are negatively impacted, the way this is going to work is, in my vision, is that we're going to see a phased rollout of a lot of testing for the states and for the municipalities. The places that were negatively impacted the most, obviously, we need to get a handle on what that looks like. And in order of testing, you're going to see clearly all healthcare patients and all healthcare workers get tested, every one of them. Then you'll see first responders. Then you're going to see all the other essential workers, grocery store workers, sanitation staff, and then finally the rest of the country. So that's why the testing is so important, is to give confidence that we know we have a handle on who's got the virus and how big of a population that is. So with that in mind, then after that gets done, or in conjunction with that over the next 30 to 60 days, certainly maybe over the next 3 weeks, we're going to see, Scott, this massive ramp up that's going on with the production of gear for the economy, for healthcare workers. And we can talk a little bit about that later. And then with that, once we have that gear so that we can meet the capacity needs for the healthcare system to deal with the coronavirus, then we're going to have a lot more confidence of doing the phased rollouts of different industries. My guess would be the first industries that'll be rolled out will be manufacturing, and then construction, and of course, the financial sector. Financial sector is probably work from home anyway for the most part, but those other two, we're going to follow most likely some of the examples led by China as far as getting their factories back up and working, and construction as well. There'll be protocols developed for doing that. There'll be likely testing, maybe at home first. I'm not sure, maybe there's just a simple temperature test, or maybe there's a 15-minute COVID test that you can do, that you can log the results in. Maybe you'll see something along those lines. But that's where I think we can do this phased rollout. And it's going to happen. It has to happen. And whether it's May 1st or not, it has to happen sooner rather than later for all of the reasons that I showed you.
You called May 1st. You can't back off of it. Hey, Andy, you have a slide, I think it's 2 away, that you talk about specifically healthcare and manufacturing, what the setup is. So the government, you talked what the Fed's doing, what the incentive packages are, but can you go to that and talk specifically what you see the setup is for healthcare businesses, for manufacturing businesses to be able to get to speed quickly and capture opportunity?
Yeah, sure. So let me just touch on that, just to highlight in the emergency spending that's coming from the federal government. There's $117 billion for hospitals and veteran healthcare. There's $45 billion for FEMA disaster relief fund, $16 billion for a strategic national stockpile, $4.3 billion for CDC, and $11 billion for vaccines, therapeutics, diagnostics, and other medical needs. So there is a ton of money that's coming into the healthcare space. Now, with that in mind, I think it's really important that what happens in a crisis, right, is that we ratchet back on a lot of the regulations that we have to kind of clear the runway to get things moving again. And certainly that's what we're seeing when it comes to healthcare, and certainly with the vaccines and the therapeutics that are coming. the speed at which they're allowing the development to occur and come to market and be able to do tests have been greatly reduced. Everybody wants to come up with a solution to this as soon as possible. And it reminds me a little bit of, how so much of the early development of different medicines occurred back in like the 1920s, 30s, and 40s, where people used to test it on themselves. We're not going there, but I mean, that's kind of the vibe that you get from the government about, how fast it wants people to do things. So all of these big pharma companies are engaged rapidly in trying to come up with a virus solution on the therapy side. And that's really important. And as I mentioned earlier, that's the rollout of these testing. To some extent, that's part of that, but also the therapies. If you can reduce the time at which somebody gets the disease and then becomes well again, that will, again, enhance the ability of the economy to come back faster. So when it comes to healthcare, that's why I think there's a good chance that we're going to keep a soft regulation touch going forward. As I mentioned, there's just a ton of money and grants coming for healthcare providers. Also, a lot of support for implementation of these different protocols as well. That's coming. And really, from the Federal Reserve, I think the one thing that you can remember is that money is going to be cheap for a long period of time. And that's obviously, go ahead.
For a second, I'm getting a lot of texts right now with questions around specifically just getting back to business as usual in healthcare. So a lot of the clients that are on the call right now, or friends of the firm that are on the call right now, they own retail healthcare practices or surgery centers. So elective surgery, going in for your eye checkup or procedure,
right.
Going in for your dental procedure. And I know that testing, and if the answer is just they're going to have to figure out the testing protocols, then that's what it is. But there's the PPP program. Is there anything else to help those businesses right now, or is it basically PPP and wait for further instruction?
Yeah, I think it is. I mean, yes, it's been a train wreck to get these loans, specifically about the payroll protection. But my guess is there will be additional help coming. I know that's not helpful right now, but as far as getting your surgery centers open and especially the elective surgeries, this is all about creating the protocols that we need to have in place so that businesses are protected, that if they allow people to come in and get a surgery done, that their liability is not there if someone picks up the COVID virus from being open. You know what I mean? So that's significant from a legal standpoint. From a funding standpoint, there is, I kind of ran through some of the numbers. I mean, it's $350 billion in loans to small businesses, especially on the payroll side of things. That's really what their focus is. But they're also working right now, and I'll mention this too, on an additional lending program that's going to, and it could be grants. It's hard to say exactly what this is going to be, but this is the next phase of a stimulus program for small businesses, and that it's being worked on right now in Congress. They had a number of about $250 billion. That seems to be at loggerheads between the House and the Senate right now. I think the House wants it up to $500 billion. We'll see where it goes, but there's another package that's coming, and we haven't quite worked out what that's going to look like just yet, as far as whether it's grants or lending and to whom it's going to go to. But it is a tremendous focus on small businesses, and I think that's important.
So Andy, we promised 30 minutes. I have a few slides I want to get to quickly, and I think on the manufacturing side, a lot of it's similar. There's not as much deregulation that's going to come into play, but on the manufacturing side, there is the fact that the fuel costs are lower, that this is going to be a huge focus of getting the economy up and running, is getting manufacturing up and running, the demands there. And then also that the fact that you believe that there's going to be a lot of incentive toward moving production to US from overseas.
Yeah, the next slide down, let me just put that up. These are some of the key takeaways. And I think that's a great point that you made. I guess what I would say to people is like the trends that were in place prior to this crisis hitting have now been supercharged, and you can see what those look like. It will take a while, granted, for people to get comfortable going and doing elective procedures, and I understand that. But I will also say you can't keep this economy shut down and stop people from going out and getting the healthcare that they need. Whether it's elective or not, it will begin to happen. But there's some of the interesting things I have there, reshoring, especially on the supply chains and especially on important pharmaceuticals. I think you'll see that change. And for manufacturing, this is good news, but I think it's going to be focused kind of on the old NAFTA countries. And then you can see some of the potential new developments. So I'll just I won't read those off, but people can see them.
Yeah, could you go to my slides real quickly? I want to mention on the manufacturing call I just got up on before this was really around the opportunity of manufacturing around automations in companies that are really good at manufacturing automations and simplifying supply chain are going to have a real opportunity here, just for the fact that the automations are also going to be a health improvement because you're going to be distancing people within your facilities. So just something I wanted to address real quick on, what do we know from a business development point of view? What we've been doing over the last month is helping companies reposition their sales and marketing. And sales has not been easy through this because frankly, you just couldn't sell for a while. One, because there wasn't a market, and two, because you're kind of a jackass if you were trying to sell when everybody's at gridlock. But what we know now is that the reopening is coming. The government's going to help by getting out of the way and providing cash and incentives. So defining your opportunity should be the main priority for folks right now. It's time to define the opportunity and position for it, or in some cases, we're even rolling it out. So the equation that I use on defining the opportunity is urgency equals speed plus ROI. And so I wanted to show a couple examples. This is a 3PL, the company's Exigistics, and they're one of those companies that are going to capitalize on supply chain improvements, moving into the post-COVID environment. Manufacturing's not ready to buy yet, but we're transitioning from that, hey, how can we help? We're here to help. We're in this together message, which is what we did for a couple weeks, to, hey, it's time to prepare. So this is a case where the company has relevance for their sales team to reach out to their contacts and say, it's time to prepare. And what we've done is develop some content for them to show what that ramp up looks like so that they're ready from a staffing perspective. So we're going from phase one of, hey, we want to make better relationships and improve our relationships and improve our brand image, and we'll do whatever we can. How can we help? To, hey, it's time to think about preparing. Let's get in here and do the work. And if you can go to the next one, this is an example of we're going to market already with a healthcare consulting firm. We're really active in just being helpful for the first 3 weeks, working on being prepared to have sales momentum when there's no sales market at all. And then some federal money became available for the healthcare targets that they help. And we immediately switched from helpful to now we want to come in and do an engagement. Now I want to go through just one more slide here on what that means. We still have to be very careful, and we have to be good partners to the community when we're doing this. So yes, we're identifying what's the opportunity in the market right now. In identifying it, we also want to package up why you're the best partner. One, because you've demonstrated you're a great partner through COVID-19. Two, we want to leverage the amazing work that your team has done. So look at these amazing Herculean efforts that you've seen happen within your team and working with clients. Position that offering with that urgency plus speed plus ROI, and be flexible. Everybody's crushed right now. So are there fees you can waive? Are there barriers that you can take out of the way on different steps that you usually need to go to market? On the watch out side, and this is possible, but it's going to take some thinking. You really need to think these things through. You cannot appear predatory. You cannot appear opportunistic at this time. It has to be positioned as helpful, and beware too much too soon. Don't try to sell too much. Get in, provide some return on investment, and grow. And then remember, every single one of your service lines is not going to come online at the same time. So it's really focusing on where can you provide value right now, where can you do it fast, and where can you prove that it's going to have a return on investment. All right, that's what I had. We are at 11:29, and most of the comments I've just gotten is that I sound a lot smarter than you and I'm better looking. So there's not a lot of questions. Is there anything else that you wanted to say, Andy?
Yeah, what I would say is just I always try to provide context, right? So the government's actions were not directed to eliminating or eradicating this virus. They were merely trying to get us to a point where we could deal with the surge. It looks like we've done that. It looks like in a short period of time, we're just going to have massive production of PPE gear and everything else that hospitals need. We're going to continue to see expansion of hospitals, redundancy. And I think, to me, it's fascinating to watch what people are doing already in a wide range of industries to adapt to what's happening. And the people that are being successful are doing it now and preparing for that reopening, even though it's really hard. I mean, if you don't have money coming in the door, it's really hard to think beyond that. But I think that's the opportunity for a lot of people. And I hope this has been helpful today.
For people who have questions for you, how do they reach you?
Yeah, you can reach me at you can reach me through my website, andrewbusch.com, or you can just send me an email, andy@andrewbusch.com, ANDYBUSCH, right? So andy@andrewbuschbusch.com.
Yep, and we're going to send out this recording, so you'll have all that contact information as well. Thanks everybody for attending. We appreciate it, and best of luck moving forward.